Do you believe in hope? Why do I ask? Because I think this affects how you respond to the coronavirus pandemic. I was talking to my buddy, he's an ICU doctor, intensivist, and he was saying how, this thing is going to last for 5 years. There's nothing we could do to stop it. Old people dying, that's just sort of life. Old people are meant to die anyways. When you're 86, you're past your life expectancy. I mean, if you didn't die now of the coronavirus, you would have died in 6 months from something else anyways. You're just bound to die. And do you really want to be wearing a mask for the next 5 years? About this whole reopening of the economy, of course more people are going to die when the economy reopens. That's just life. More people are going to get it. But you can't prevent the economy from going on just because of this stupid virus. Just treat it like whatever, he would say. And you would think that there's a lot of logic to what he's saying. Except as I was thinking further about it, I realized, wait a minute. He's talking about futility. He works in the ICU, he has a lot of sick people, but do we try to save them or do we not? So much of what you do in the medical world is futile, as in there's a low chance of success. But do we try? Do we try to save the 90-year-old man who was in pretty good health before? Or do we just say, oh, you're 90. You're like quite a few years past your lifetime. So we'll just let you pass on quicker. Quicker is probably better, right? Don't bother trying. Why do we try? He made a comment that it's really hard to fight viruses, and that's absolutely correct. We have a miserable rate of coming with vaccines, cures for viruses. Yeah, that's absolutely correct. But I guess the question is, do you believe in hope? See, the idea is that we think about progress. We think about things improving year after year. I remember one cardiologist, this was a decade or so back, talking about heart valves. They were coming up with replacement heart valves that you could go through the blood vessels. There's a much easier procedure than open heart surgery, obviously. And they just weren't up to snuff at that point in time. But he's like, yeah, I would still get it replaced via the blood vessels. Because, yeah, it may wear out sooner rather than later in a year or two. But by that time, there'll be a newer, better one out. Technology will have progressed. And I just rely on that. I depend on that to make my decision. I think that's the thing. How do you view our world? Do you view it as a hopeful place where things get better with time? Or is it all going downhill? We're all going to die anyways, right? Literally, we're all going to die. Nobody's ever prevented us from dying. So what's the point of doing all this stuff when we're all going to die? He was asking, what's the point of flattening the curve? We're just pushing off the inevitable. I think it depends, again. How do you view our world? Are you hopeful about the future? Because if you are, you'll look at stuff differently. Look, we've eradicated HIV. Not eradicated, but made it so it's just a chronic disease. It doesn't kill people. It's not a pandemic anymore, and it's a virus. Very difficult to deal with. We've basically cured hepatitis C, assuming we could pay for the treatment. The new drugs are so much better than before. With their cure rate, so much easier to take just some pills. Wow, that's good. We have successfully overcome some viruses. See, it's not about pushing off the inevitable. It's about holding off the onslaught until somebody comes in, some cure, some vaccine, and then we could just crush it. And that's what I'm hopeful for. And that's why I want to do my part. Masking, social distancing, doing what I can to push it off. So there will be no inevitable, but rather we'll all go back to normal life without the deaths that people say have to happen. Because I'm hopeful we'll come up with a solution.